Hello, let's look at the topic natural methods of contraception. The overall advantage for these contraception are that we don't give any exogenous hormones or chemicals. Therefore, there are no side effects. It is free or low in cost. The disadvantage is high failure rate. It is also the reason for non-preference of these contraceptives. The first method is coitus interruptus. In this, the male partner withdraws before ejaculation. Therefore, it is also called as the withdrawal method. In this method, there is a risk of timing errors and sperm in the pre-ejaculate. The second method is calendar or the rhythm method. It is based on normal menstrual physiology. Generally, the safe period is considered 7 days before and 7 days after bleeding. Let's look at a type, Tirumala method. Tirumala method is also called as the cycle beads. Here is the Tirumala. The white beads show the period in which there is most likely chance of conception. Conception is most likely here. For the brown beads, conception is very unlikely. Now this red bead, it shows the first day of period. This band here is movable rubber ring. And this dark brown ring which we are seeing shows the 26th day of the cycle. Let's look at the advantages. It is easy to teach, easy to understand and use. Therefore, it can be used by tribals and uneducated. The disadvantage is that it can't be used for irregular periods. That is, very short cycles of less than 26 days or long cycles of more than 32 days. The next method is lactational amenorrhea. It is based on a physiological response. It is the normal response of the body after a female gives birth. The prerequisites are that she should be exclusively breastfeeding her baby. It should not be more than 6 months after giving birth, and she should be experiencing amenorrhea. A quick question. What is the best contraception method if the female is lactating? Progesterone only pills. Next, the next method is basal body temperature. In this method, we monitor the female's body temperature and we see that there is a rise of 0.3 to 0.5 degrees Celsius prior to or with ovulation. The next is cervical mucus thinning. This is also called as Billings method. So this is the cycle, the menstrual cycle. This is the day 0, day 3 to 4. After day 3 to 4, for 1 to 2 days, the female is going to experience a dry phase. After the dry phase, the amount of cervical mucus will increase, it will become copious and it will become thin. This amount of cervical mucus will decrease. This is monitored in Billings method. The basal body temperature method and cervical mucus thinning method, both of these methods show fertility more than contraception. So they are used more for monitoring fertility. The sixth method is symptothermal method. In this method, any natural contraceptive is used along with basal body temperature. The most commonly natural contraceptive which is used here is the Billings method. Here we are talking about total abstinence, that is, the couple is not performing sexual intercourse anywhere in the cycle. Okay, we have talked about abstinence in Tirumala method also, rhythm method also, but there it is partial abstinence. We are abstaining from sexual intercourse only at certain periods of the cycle. Here we talked about total abstinence, that is the difference. So these are all the methods of natural contraception. Thank you.